Good afternoon, everybody. My name is Travis Dunlap, and I'm with the Education Facilities Clearinghouse based here in Newport News, Virginia. The Clearinghouse is a federal program managed through George Washington University, and we provide free technical assistance and training to public schools and public universities to help improve any facility issue. We're happy today to be partnered up with the Coalition for Healthier Schools, and as we present this webinar. And our webinar presenter today on the topic of lead in water will be Dr. Jerome Paulson. Dr. Paulson is an emeritus professor of pediatrics and emeritus professor of environmental and occupational health at George Washington University. Dr. Paulson is the past chair of the Executive Committee on the Council of Environmental Health of the American Academy of Pediatrics and has served on the Children's Health Protection Advisory Committee for the US EPA. He is also a consultant for the Healthy Schools Network, and we're happy to have them along with us today as well. They're sponsoring this webinar as well. Dr. Paulson received his bachelor's degree in biochemistry with honors from the University of Maryland, College Park, and his MD degree from Duke University. He did his pediatric residency at Johns Hopkins and Sinai Hospital in Baltimore, Maryland. And we are very happy to have him along today. He's going to be presenting on the topic of lead and water. So I also want to draw your attention to one document here. This is the lead in drinking water, which is produced by the Healthy Schools Network. I'm going to send this link to everybody. Some of you may have already received it. If you haven't, you're going to receive this link in the chat box. If you have any chats or any questions or anything that you want to say, you can direct it to me. I'm Travis Dunlap. Or you can address it to the group at large in the chat box. At the end of the presentation today, we will have a time of Q&A, and we'll be accepting questions of Dr. Paulson at that time. You'll see in the chat box now, there is the PDF that you are seeing here on your screen. You can download it by clicking on that link there in the chat box. Okay, at this moment, I'm going to turn it over to Dr. Paulson, who will be taking on the rest of the webinar.
Everyone, thank you, Travis, very much for introducing me. I'm glad to have this opportunity to talk to you today about a problem that's vexing to very many school districts around the country, parents, pediatricians. It's a problem that we don't really know the scope of, but probably impacts on a very large number of children in the United States. So I do some work with the American Academy of Pediatrics, helping to manage the Pediatric Environmental Health Specialty Unit program, and I will tell you more about the PACEUs later in the presentation. The PACEUs are indirectly funded by the Agency for Toxic Substances and Disease Registry and the EPA, and they asked me to let you all know that I'm not speaking on their behalf. And as Travis mentioned, I have been a consultant to the Healthy Schools Network. The issues that I need you to think about as we go through this presentation are: how does the water get from that river, that lake, that underground aquifer into your school? Or really, it's the same story in homes, in office buildings, in any building in the United States, really. Where can that water pick up lead? What happens when the lead gets into kids? And how can we prevent this exposure to lead from occurring in the future? As I said, we really don't know how many kids have exposure to lead in water. We don't know how many school systems have water that has lead in it. We don't know how many communities have water that has lead in it. We certainly all know about the situation in Flint, Michigan that's been going on for the last year or more. And just a cursory glance at any number of newspapers, news websites, or other media outlets will tell you that there have been hundreds, maybe 1,000 or more news reports across the United States about lead in water, either in a child care center, school, or in homes. It's also another reason that we don't have any idea of the scope of this problem is that there is no requirement for universal testing of the water at the tap, whether it's a sink, whether it's a water fountain, whether it's a faucet in a kitchen, in a school building. There's no requirement for universal testing of that water for lead or any other contaminant for that matter. The U.S. Environmental Protection Agency does require testing of water systems as a whole, but for example, I live in Alexandria, Virginia, and I don't know how many, maybe 100 or 200 faucets need to be checked in the city for the water utility here to be in compliance, but they don't have to be in schools, and oftentimes they're not in schools. They're more often to be in homes. In the unusual situation where a school has a well and serves more than 25 children, then the school is defined by the EPA as its own water system, and under those circumstances, the school must do the testing the same way that my water system in Alexandria or your water system in your community needs to do the testing. But that's the only circumstance where there is a mandate for testing in school buildings at the federal level. There's been some legislative activity recently, and I'll get to that later, but by and large, there's no requirement for testing of water in schools. So this bar graph, which you also saw very briefly in the handout prepared by the Healthy Schools Network, is an indication of where sort of the supposedly average child, in quotes, in the United States gets exposed to lead, or how that average child gets exposed to lead. And the most common source of lead for kids in the United States is still dust from old lead paint, but water is the second leading cause. And for example, in a very young child who is fed by formula, and that formula is reconstituted from powder or diluted from a concentrate using tap water either from a home or a child care center that has lead in it, then water is going to be a much more significant source of that individual child's lead than will these other potential sources. So while this is a general distribution, it does not apply to every single child in the United States. So that leads me to make the point that while lead in water is important, and schools, I believe, have a moral obligation, if nothing else, to universally check their water systems for the presence of lead. Lead in water is not the major problem with lead in the US. It's still lead paint. But in school buildings, in early childhood centers, in daycare settings, those facilities, I think, have an obligation to check for lead in water and reveal the results of that testing to the parents of the children involved in a timely fashion. So where do we get our water from? The picture on the left-hand side of your screen is Hat Case Pond, which is the water supply for Brewer Water District in Maine. It's a pretty picture, that's the reason I chose it, but that's water from a surface water, and that can be from lakes, from ponds, from rivers. Here in the Washington, D.C. area where I'm based, the Potomac River is the major source, another source of surface water. And then on the right-hand side of the image, you can see a diagram that shows water being pumped up from an underground aquifer, in other words, groundwater, and then being taken into a municipal water supply system. Once it's in that supply system, it then has to get distributed. So sometime in the 1990s, my wife and I had the privilege of visiting Pompeii in Italy. And as you know, Pompeii was destroyed in the year 79 by a humongous volcano. But in that time, right after the beginning of the first millennium of the Common Era, in Pompeii, they were using lead pipes to distribute water throughout that city. And this is a picture of a nearly 2,000-year-old lead pipe that I took when we visited Pompeii. So as you can see, one of the reasons for using lead pipes is they last a long time. In today's water system, of which you can see various images on this slide, the pipes are a lot bigger. You can see over there in the upper left-hand side pipes as big as a man. They're, in most instances, thankfully, not made of lead. So on the bottom in the middle, you see some concrete pipes that have been used and cut for display purposes. Water is stored in big storage tanks, etc. So that's what some of the different parts of today's water distribution system look like. This is on the left, this is a diagram of the water intake from Lake Huron going into the water system of Saginaw, Michigan. Now, this is similar to a myriad of other systems. I didn't pick them out for any particular reason other than they had a very nice image that was available for use. But I wanted you to see that pipes go out into the middle of this Saginaw Bay, which is part of Lake Huron, and then pump the water through pipes down to Midland and other Saginaw and Bay City. On the right-hand side, you can see more of a drawn diagram showing a treatment plant, the water coming from either the surface source or the underground source, going through the treatment plant, being placed in the storage tank, and then distributed through the mains to the buildings in the region. The water coming from the surface water or the groundwater usually has almost no lead in it. And in the treatment plant and storage tank and water main distribution part of the distribution system, it does not pick up lead because there's very little exposure to lead in any of those pipes or components. The problem occurs in what's called the service line. And again, if you look at this diagram, look at the water main underneath the street in front of these buildings, look at the sewer main underneath the street, and then the water line or service line going into the buildings in blue and the sewer line coming out of the buildings in lead. The American Association of Waterworks, the American Waterworks Association estimated that about 7% of homes, 15 to 22 million Americans, have lead service lines. And this is one of several places where water can pick up lead and then deliver it to the people who are drinking that water. The practice of using lead pipes in the United States goes back over 100 years, particularly in large cities. It's estimated by some research that Dr. Rabin published in the American Journal of Public Health in 2008, that by 1900, more than 70% of the cities with populations greater than 30,000 used lead water lines. Now, physicians and others started to learn about the hazards of lead paint also in the late 1800s. And in 1890, aside from concern about lead paint, the Massachusetts State Board of Health advised the towns and cities in Massachusetts to avoid the use of lead pipes. However, and some, not only in Maine, but not only in Massachusetts, but elsewhere around the country, some cities did heed that warning and published plumbing codes prohibiting or limiting the use of lead pipes. However, the Lead Industries Association, as they were documented to have put out all sorts of false information about lead in paint, also put out false information about the hazards associated with lead in pipes, and this is also well documented, and they lobbied very hard to keep requirements for lead in plumbing and other codes, and continued to do that until the 1970s. It was only in 1986 that the Federal Safe Drinking Water Act amendments prohibited the installation of lead pipes. But that was the new installation of lead pipes. That didn't do anything to the hundreds or thousands of communities around the United States that had had lead pipes installed, and those in many instances are still very much in use underground, waiting to contaminate the water that comes through them. So this diagram is a little more detailed than the one I showed you before, but if you look sort of to the left-hand side of the diagram, you'll see that long pipe there. That's the water main running underneath the street. And then you'll see going from that pipe to the building on the right-hand side, a small pipe that leads to a service connection, and that I've put a blue box around, and then to a soldered joint, another blue box, and then to faucets and water coolers. This is a diagram of a school building, and these are all the different places in a school building where there might be lead either in the service line, in the soldered joint, in the faucet or the water cooler. But again, the same can be true in a child care center, at homes. There aren't so many water coolers at homes, but certainly faucets and soldered joints. And then this is a picture of a lead pipe coming through a cement basement floor into a building, and then a large amount of solder is used that's also made out of lead, that's used to connect that lead pipe to the main distribution pipe in this building. So again, water coming from the street generally has almost no lead in it, but then as it starts to pass through these pipes and other components of the distribution system that are either made entirely of lead or have a lot of lead in the mixture of metals that goes to make up the faucet or what have you, then that's where they pick up the lead that then gets delivered to the people who are drinking the water, cooking with the water, showering with the water, or bathing with the water. And I'll come to that. Those two aren't all that important. It's the drinking and the eating of foods that are cooked with water that's contaminated with lead that are important. This is just a picture of some copper pipes that many of you can see probably in your own basement. And these particular copper pipes have been soldered with solder that included, at that time, a lot of lead, and that's available to be leached out and into the water. This is a picture of a water fountain taken relatively recently in Portland, Oregon, one of the cities around the country that took a number of water fountains out of service, as you can see from the sign, pending lead testing. But again, there have been dozens, if not hundreds, of school buildings and or school systems that have documented high lead levels in a few or in many places throughout their system. There was a URL that was available in the chat box from an article concerning a town called Voorhees, New York, in today's news announcements. So this is the sort of final end of the water system for most of us in terms of this is where we actually put the water into what we're going to drink from. Now that faucet is all nice and shiny and covered with chrome, but the entire faucet isn't made of chrome. It's usually made of brass. And that brass is a mixture of a number of metals. And in the past, these faucets could contain lead in that mixture that was used to create the brass, and therefore the lead could leach into the water. The aerator that you see here, both being removed from the faucet and then on that individual's hand spread out in its parts, is important because some of the lead that gets into the water comes as it's dissolved directly into the water. But sometimes tiny little particles of lead break off in the system. If there's an aerator on the end of the faucet, that usually has a filter in it, and that may remove some, but certainly not all, of those lead particles. And if the aerator is taken apart, and that's not done carefully, if somebody dumps the contents of that into a cup of water and drinks it, that's quite a bit of lead. So understanding how all of these things interact together is very important to understand how to protect kids and anybody else, teachers, administrators, other employees in school buildings, various parents, visiting parents, in the school building. And again, this applies to water at home and water in office buildings and whatnot. Prior to 1986, the legal definition of lead-free was up to 8% lead in pipes and fixtures and less than 0.2% in solder. So what was deemed legislatively to be lead-free clearly was not lead-free. And so aside from the fact that the lead pipes antedate much of the Safe Drinking Water Act legislation, even the legislation and any changes that it made for systems being installed after the legislation was passed didn't give us the kind of protection that we really needed. In 1988, the Lead Contamination Control Act was passed, and that put in a recall for drinking water coolers with lead-lined tanks, many of which were in schools in that period of time, but the testing of the water and proof of any remediation having been done by the schools was voluntary. So in many instances, it's been well documented that these water coolers were not removed, certainly in the 80s and 90s, and in some instances may even still be in schools today, although you would think that many of them would have worn out by now. In 1991, the lead and copper rule that you hear about over and over again was passed, and this is what requires the public water systems, that's what the PWS stands for there, the public water systems to monitor for lead, but they don't check every single faucet in the city. They only check some selected number of faucets, and if a proportion of those faucets are delivering water with more than 15 parts per billion of lead, then the whole system needs to undertake action. 2 points to make here. One, the system takes action. So the individual points where they're measuring elevated lead in the water are not dealt with on an individual basis. It's dealt with on a systems basis. And number two, and more importantly, 15 parts per billion is not a health-based standard. It's not a standard where we know that if people drink water with less than 15 parts per billion in it, they will not be injured by consuming that lead. Or to put it another way, people who are consuming water with even less than 15 parts per billion may still be injured by consuming that water. In 2011, we finally got a law, an amendment to the Safe Drinking Water Act, the Federal Reduction of Lead in Drinking Water Act, that brings down the allowable level of lead in new fixtures to a more reasonable level, redefining lead-free as up to 0.25% on surfaces in contact with water, meaning the pipes and fixtures. But again, this does not at all require the removal of any old materials that don't meet the current standard. It just means that in new buildings, new construction, or in renovations, any materials that are bought new and installed have to meet this new standard. So again, just to reiterate in terms of the lead and copper rule under the Safe Drinking Water Act, the lead action level is 15 parts per billion, and that's if in more than 10% of the sampled taps, the level of lead is 15 parts per billion or greater. But what the water companies have to do is educate the public and treat the water at the treatment plant to make it less corrosive. That should reduce the lead coming out of those taps, but there's no check of individual taps. And whoever's got the dog, please mute your phone. No check of the individual taps, and no guarantee that the corrosion treatment has remediated the problem. The CDC put together a document in 2006 that states that 26 states in the Union require districts and schools to conduct periodic inspections for lead in water. But that's on the basis of self-report. Nobody has independently gone to the state codes to look at those laws, and we have no information on compliance with those laws and what's changed since what we thought we knew in 2006. The Government Accountability Office, the GAO, compiled some data around the same point in time, but also that did not involve actually looking at the laws of the individual states and their codes. Everybody, I think, probably has heard of the federal code but there are also codes for each individual state. In the most recent year, this 2015 to 16 year, we do know that about 20% of the states have considered legislation relating to lead in water in schools, and that some legislation has been passed in the District of Columbia, New York, Ohio, and Rhode Island. We don't know what the regulations are that are going to be written for some of those laws, because like the DC law was finally passed last week, I think. I'm sorry, the New York law was finally passed last week. And we don't know what the compliance will be going forward, but there is some little bit of progress. There also are issues with the way the samples are processed when they're collected. It seems to me, before I started looking into this, that it should be fairly simple. You just, turn on a tap, you collect some water, you send the water to the lab, and you know how much lead is in that water, and then you can tell people whether that faucet needs to be repaired or not, and whether they can drink from that faucet. But it is not at all that simple. The water collection, how fast the water is allowed to run, how long it's allowed to run, whether the samples are processed in the bottle where the water was collected or poured out into other laboratory containers, even whether the sample is shaken up immediately prior to putting it in the machine to do the measuring. All of those things influence the results of the tests. So Clark, Masters, and Edwards, Mark Edwards in particular from Virginia Tech, who's done most of the world's best work on measuring lead in water, published this paper 2 years ago talking about how, in their opinion, sampling should be done to better characterize the amount of lead that's actually in water being drawn from taps. That is not what will happen if the water utilities follow the current EPA regulations, and so there needs to be some further discussion by EPA, by individual school districts that want to do this on their own, as to what collection and processing methodology they should use. But I would certainly recommend that school systems take a look at this paper published in Environmental Science and Technology in 2014. If you want to get the lead out, you got to get the lead pipes out of the system. You got to get all of the fittings, the taps, the solder joints, everything out of the system. That's really the only way to totally get rid of the lead. Filters can be used. There is a third-party independent certifying agency known as NSF, and that's its name, NSF. It is not the National Science Foundation, that certifies all sorts of water filters for all sorts of for all sorts of contaminants. And so you need a water filter that's certified by them to remove lead. You need to check that, in fact, that faucet is doing what it's supposed to do. You can't just install it and assume that it's working. And all of the filters have a lifetime, and they need to be replaced at the end of that lifetime. So even though you checked the faucet this year in school and installed a filter if it seemed to be needed, you need to check that faucet again in the future. The American Academy of Pediatrics, in its most recent document on lead poisoning prevention, recommends lead at the tap to be less than 1 part per billion. Again, even this is not a health-based standard, but it is certainly much less than 15 parts per billion, and it's down around the lower limit of what many commercial labs are going to be able to measure, and at least I think should be a target for schools that this is the target that the District of Columbia schools have chosen to decide whether their taps need to be managed for lead in the water or not. So what happens when the lead gets into the body? Most of the lead that anybody is exposed to is going to come from what they put in their mouth, whether it's little kids with dust on their hands, whether it's kids or adults of any age who are drinking water that's got lead in it. Almost no lead is absorbed through the skin, so if you take a bath in a tub full of water with lead in it, assuming you don't drink that water, your exposure is going to be very low. On the other hand, lead, when it's inhaled, either because it's in the water in the shower, you know how misty your mirror gets when you take a shower, or if somebody's burning wood that was painted with lead in a fireplace, or if somebody lives near a smelter. Lead delivered to the lungs leads to very rapid absorption and very thorough absorption into the body. So we worry primarily about oral exposure and inhalational exposure. For schools, the biggest issue, of course, is going to be oral, because other than the adolescents and middle school kids who may be showering, most kids in the school aren't exposed to aerosolized water. The youngest of kids absorb the most lead that gets into their GI tract. Adults absorb much, much less. So kids 0 to 2 absorb about 50%. Adults absorb about 10% of what goes in their mouth and down to their stomach. Obviously, kids in between, as you can see, absorb differing amounts less as they get older. So that's one of the reasons why we need to be concerned about lead in water in schools. But for the older kids in schools, at least thankfully, they do absorb less of that lead that they're exposed to. In terms of how we measure lead in the blood, that number is influenced by how much enters the body and really by how much is absorbed, because I mentioned a moment ago, certainly some of what goes into the mouth then just goes straight out the other end and doesn't get absorbed at all. But how much is absorbed through the lungs, a whole lot, a very large proportion is going to be absorbed. How long that exposure goes on, is it 1 day, 5 days, 15 days, or does it go on every day for a year or 3 years or 5 years? That makes a big difference. The age of exposure makes a difference, not only because of the difference in absorption, younger kids absorbing more, but also the degree of sort of completion, if you will, of the brain. We know that lead is toxic to the brain in adults, so it's not that the lead is never toxic to the brain, but it does certainly seem to be more toxic the younger the kids are than older kids or adults. And then there are probably some genetic factors that we don't at all understand that makes different people metabolize lead differently. But we do know that kids who have, as best we can tell, very similar exposures have different severities of outcomes, even though their exposures were similar ages, similar blood lead levels, similar amounts of time, things like that. And then outcomes, so just having the lead in the body is not the important thing. It's what it does to the brain and less so to other organ systems, but other organ systems are affected as well. And what the lead does to the brain is influenced by the same things that influence the blood lead level. And then there are probably factors related to parenting and/or education, again, as I said a moment ago, we know that kids who've had similar amounts of exposure over similar amounts of time don't all have exactly the same outcomes, and exactly what influences the distinct outcome in individual children is probably some of these other factors, but we don't understand that in great detail. While lead exposure leads to IQ loss, and that's very important, particularly on a population basis, it's what lead does to the brain related to increased incidences of learning disabilities, attention deficit disorder, and aggression or other behavior problems that makes the management, particularly of the low blood lead levels, the 5s and the 10s and the 13s and whatnot, so very important, and really makes the prevention of those exposures so important, because once the exposure has occurred, there's nothing that we can do as physicians to reverse any adverse outcomes that have occurred. So the impact on any one child of a blood lead level in terms of their IQ going from, say, 1 to 30, which thankfully doesn't happen very much at all today, is about 9 IQ points. And for kids between 1 and 10, it's not proportional. It's more loss at the lower levels than at the higher levels, 6.2 IQ points. For the individual child, that's relatively small. But on a population basis, that impact is extremely meaningful. And that's why we continue to need to struggle and resolve this issue of exposure of children to lead in the United States and around the world. And I'll show you a graph in a moment. Well, let me do that now. If one shifts IQ, the average IQ in a population, just by 5 points, it has a tremendous impact. So if you look at the graph on the left-hand side of this image, as you know, psychologists define the IQ of 100 as the mean for the population. And if you presume a bell-shaped curve distribution with 2 standard deviations above the mean being defined as intellectually gifted, that means in the more or less typical birth cohort size in the US, there are about 6 million intellectually gifted kids and 6 million intellectually impaired kids. Shifting that IQ, look now to the right-hand side of that graph, to a mean IQ in the whole population of 95. Only change the mean by 5 points. You decreased the intellectually gifted cohort to 2.4 million from 6 million, and increased the intellectually impaired population from 6 million to 9.4 million, or a 57% increase. So that's why it is so important to prevent exposure to lead in children in all populations and under all circumstances in the United States and elsewhere around the world. Now, we, with our very sophisticated tools in this day and age, can even show dramatically in real time the impact that previous lead exposure has had on the brain. So on the left-hand side, you see 9 MRI images from one child who had a high blood lead level for a long period of time. And what you need to look at is the difference in the areas that light up between that child on the left-hand side and on the right-hand side. The child had a 7.6 mean lifetime blood lead average, which today we would consider high, but in the days of this study was not all that high. but yet you can see very different function in the brains at the two different levels of exposure. And that is just a more dramatic, I think, demonstration of why we are still concerned about this. If we're worried about schools, we're worried about adults in the school buildings, and in particular, probably the cohort that we need to consider the most outside of the kids are women of childbearing age and women with significant elevations of blood lead levels who become pregnant can have preterm labor, greater risk of gestational hypertension, loss of pregnancy, low birth weight, and then impaired development of their child as she or he grows. Now, some of the lead in the mom's body may come from current exposure, but if the mom had elevated lead levels when she was a child, she stored some of that lead in her bones, and when she becomes pregnant, that lead comes out and goes to her fetus, even if she's not having any current exposure. So again, lead not only is toxic in a single generation, but lead has a second generation hit in women who had elevated lead levels when they were kids. We don't know what a normal blood lead level is, and we don't know what a safe blood lead level is. So we need to work for no exposure. For many decades in this country, we've been screening kids at around age 1 and around age 2, and trying to find, if they've got elevated levels, try and find the source of their exposure and intervene to prevent additional exposure. But what we know now is that if the kids have been exposed and if damage has occurred, we can't correct that damage. We may be able to prevent further damage, but we can't correct what's already been occurred. So we really need to have a primary prevention paradigm. We need to identify where lead pipes and lead-containing fixtures are in water systems and remove them. We need to identify homes that have lead paint in them and make those homes lead safe, and monitor both the water systems and the paint so that they do not become problems again. For those of you in individual schools or school districts, and if you've got questions, there is a system of pediatric environmental health specialty units throughout the United States where you can go to help get those questions answered. We are pediatricians, we are nurse practitioners, we are in reproductive health specialists, we are a whole host of people at academic medical centers in 10 different sites around the country devoted to answering questions about environmental health. We do most of our work by phone and or email, and there is no charge to the person who is contacting us, be it a teacher, a parent, a physician, a school nurse, a nurse in a physician's office, a nurse midwife, whoever calls us, there's no charge to anybody. Lead is the most common problem that we deal with, but this is a list. It's not a total list of all the different things that we deal with, but it gets you some idea of kind of the range of topics that the PACEUs can help you with. In 2007 to 14, again, lead was the leading reason for people to call PACEUs. Fungus and mold, it's another problem in schools. As a second leading reason, you can see the other reasons here. We do a lot of educational programming. We do sessions for docs and nurses. We can do public sessions, call the PACEU, contact the PACEU, and they will work with you to try and organize the educational activities. Today's activity, as you know, is part of the PACEU's outreach. We can do it by webinar, we can do it in person, we can do brown bag lunches, however you want us to do the information sharing. As I mentioned, the funding for the PACEUs comes from the Agency for Toxic Substances and Disease Registry, part of the CDC, and the EPA, money moves through the American College of Medical Toxicology, the American Academy of Pediatrics, and then out to the 10 regional PACEUs. We all have a toll-free phone number. We all have individual websites. The website for all of the PACEUs and the way to find the contact information for your individual regional PACEU is through www.pehsu.net. We've got various fact sheets on our website, other educational materials on our website. And again, we're there to serve the community, and I will now open this to questions from the group. And Travis, I don't know if you're going to moderate that or...
I am, Dr. Paulson. I actually have been receiving questions in the chat box. If you have a question, everybody can hear me okay, is that correct? Dr. Paulson, you hear me fine, right?
I certainly do.
Okay, so I will share with you the questions that I have here in the chat box. If you have a question, hold off until I finish reading this one because it makes me unable to see the one that I'm on. So I know that there are a number of questions here. Let's see. The first question says, what are the most misunderstood aspects of the issue, not just general public, but among water officials and even health officials, is that 15 parts per billion standard is not health-based. Can you please explain in simple language what the 15 parts per billion limit is based on, and recommend one or two talking points we can use?
The 15 parts per billion was based on what, at the time it was set as the limit, it was based on what was thought was easily achievable given the technology of the day. And so it really had nothing to do with health. And I think the single most important talking point is 15 parts per billion is not related to health. There's no reason to think that somebody drinking 15 parts per billion is, not getting too much. And that the second point is that lead levels in water need to be as low as possible. And by changing pipes and adding filters, it is possible to get lead levels down to less than 1 part per billion on repeated measures. And again, that's not a health-based standard, but if your lab can't measure any lower than that, you might have gotten better than that and never know about it. So I think until we know what a health-based standard is, and until we have even more a capacity to measure at even lower levels, that's a reasonable target in this day and age.
Okay, thank you, Dr. Paulson. I'm looking here at the next question in the line. For those of you who are sending questions, if you could hold off for a second so I can go back to what we have in line here. I know we're going to try and wrap this up by 5 o'clock, so I want to get all the questions here that can be answered. Okay, here's a question. You said that the lead in water is not a primary source. You said that lead in water is not a primary source of water, but it is for developing fetuses and those fed reconstituted formulas over 85% and up to 50% of kids 6 years of age. Let me reword this to get the intent of the question, I think. I'm having a little bit of confusion here, so I'm just going to read it. Why does lead in water testing, when it only gives you a snapshot? I guess why do we do water testing with lead when it only gives you a snapshot at the moment and can be 0 at one moment and in the hundreds of thousands in the next minutes, hours, weeks, or months? Does that make sense?
I think the point gets to I put up that slide with the reference to Dr. Edwards' work from Virginia Tech, and he is the world's expert on testing water, and the questioner is quite right. In any given faucet, the measurement of water at any given time doesn't reflect what it was yesterday or what it might be tomorrow. That's why we need to get the lead out of the system. So if we had a system that had no lead in it, we wouldn't have to measure anymore. But unless and until we do that, there is, from a practical standpoint, I don't know of any way to put a continuous measuring device on every tap.
Okay.
But yes, that's why we need to get the lead out, and why doing testing has gotten us this far. It's made us aware of an issue that we haven't been aware of, but it's not the way to solve the problem by any means.
Yeah. The next question that I have is, can you give a few practical suggestions one might start doing locally in their state and school districts? For example, who to begin to make contact with to assess screening in schools?
Every single school district needs to develop a policy to check every single water source in every building that provides water to human beings. Those faucets need to be checked. Faucets, water fountains, I'm using faucets kind of in a generic term to say anything and everything. They need to be checked at least once a year. They need to be checked using the best technology available, which may not be the current set of recommendations from the EPA. And the schools need to monitor that. They need to they need to make sure that in fact the people tasked with doing the water collection and doing it properly and handling the material properly, and they need to share those results in a quick turnaround with families of the children who go to that school building.
Okay, thank you. We have one, and I believe Healthy Schools Network has a guide on that issue for that question. And if somebody from Healthy Schools Network wants to put the link, I think they did just now. I have the link now, so I want to go ahead and send it to everybody. So I think that will respond. I'm sorry. I think I misunderstood what was happening in the dialog box. This is going to be something for everybody to see, but I don't think it's intended to be a guide to respond to the question about the steps to take. But I'll go ahead and send this anyway. And I think we have one more question.
Okay.
So you can see that link, and then we'll respond to a question here. The guide to the water issues was the first link that we had posted at the very beginning. So if you go into your chat box, for anybody who's paying attention and you want to see that guide, just scroll up in the chat box and you'll see the link to the Healthy Schools Network guide there. So the last question that we have here is, the most common fluoridation chemical that is used is a solvent for lead, and the balancing of pH in an attempt to counteract that is the height of hubris. Because chemistry doesn't have average, not only is lead a common contaminant in fluoridation chemicals, as is arsenic, but several large studies have shown that children living in fluoridated communities have higher blood lead levels. Plus, a 210 animal study by Sawan proves that any type of fluoride in water contaminated with lead increases lead absorption in mammalian tissue. So do you want to respond to that at all, Dr. Paulson?
No, that's not information that I'm familiar with.
Okay. I believe that we have run out of questions, and it is 5 o'clock, so we're going to go ahead and wrap it up there unless you have any concluding remarks. Do you, Dr. Paulson?
I just invite everybody who has issues locally to reach out to their regional PASU they'll be there to help you.
Great. Thank you very much, Dr. Paulson. This was a very informative webinar, and we really appreciate you taking the time to share with us on this very important issue. Thank you all for joining us today. We do have another webinar coming up next week. Clara Burnett from Healthy Schools Network will be presenting that. That will be next Thursday at 4 o'clock, and that will be on toward healthier schools. So we really appreciate you joining us today. Thanks again, and have a good rest of your day.